Do you ever notice a baby who seems to be developing normally at first, but then starts to lose skills like sitting up or smiling? That might be a sign of something serious. Tay-Sachs disease is a rare condition that affects babies and young children. It slowly damages the brain and nerves, leading to loss of movement, hearing, and even the ability to eat. Most children with this disease don't live past 5 years old. Sounds scary, right? But knowing about it early can help families make better choices. Have you ever heard of a disease that starts silently but grows strong over time? Let's imagine you're building a Lego tower. If one key piece is missing, the whole thing collapses. In Tay-Sachs, the body is missing an important enzyme called hexase. This enzyme's job is to clean up fatty waste in brain cells. Without it, the waste builds up like trash in a room you never clean. Over time, the buildup poisons the brain cells. This happens because the child inherits a broken gene from both parents. Think of genes like instruction manuals. If both manuals have the same typo, the body can't read them correctly. So, even if both parents are healthy, they might unknowingly pass the broken gene to their child. Could you pass something harmful without knowing? Imagine a baby who once laughed and rolled over, but suddenly stops doing those things. That's what happens with Tay-Sachs. At first, the baby seems healthy. But around 6 months, the parents might notice the child isn't developing, like not sitting up or responding to sounds. The baby might start showing jerky movements or get scared by normal sounds, like a door closing. The eyes may show a red spot when a doctor shines a light. As time goes on, the baby can't crawl, eat, or even blink. Parents might say, "My child used to smile at me, now they don't even move." These signs grow worse over months. Have you ever seen a child lose skills they once had? That's a red flag. First, they ask about family history, especially if the parents are from certain groups like Ashkenazi Jews, where the disease is more common. Then comes a simple blood test to check the hexase enzyme level. If it's missing or very low, they test the genes to confirm. Think of it like testing a car's engine. If the oil light is on, you check the oil level. But here's the hard truth, there's no cure yet. Treatment focuses on comfort, helping the child eat with feeding tubes, stopping seizures with medicine, and supporting families. It's not about fixing the disease, but about loving care. If you knew you couldn't cure a disease, what would you do to help? Can we stop Tay-Sachs before it starts? Yes, by testing. Imagine if you and your partner could take a simple blood test before having kids, just like you check your blood type. If both of you carry the broken gene, there is a 25% chance each child will get the disease. With that knowledge, couples can choose options like IVF with gene testing or adoption. Some communities, like the Jewish community, run screening programs and have cut Tay-Sachs cases by over 90%. So a small test can prevent a big tragedy. Would you take a test to protect your future children? Is there hope for the future? Scientists are working hard. One exciting path is gene therapy. Imagine fixing the broken instruction manual in the cells. Early tests in animals have shown that adding a working gene can slow the disease. Another idea is substrate reduction therapy, like turning down the tap so less waste builds up. Some kids in trials have lived longer and had fewer symptoms. There's also research on better enzyme replacement, like delivering healthy enzymes to the brain. It's still early, but every year brings new steps forward. Think about it, today's science could save tomorrow's babies. Wouldn't it feel amazing to be part of that chain?